Have you ever pondered over how medical treatments have evolved over the centuries, specifically for esophageal cancer? An interesting question, isn't it? Esophageal cancer, a type of cancer that occurs in the esophagus, the long, hollow tube that runs from your throat to your stomach, is a significant global health issue. It's responsible for a large number of cancer-related deaths around the world every year, making it an important area of study and concern. This disease has been with us for centuries, plaguing humankind and challenging our medical understanding. It's a form of cancer that can affect anyone regardless of age, race, or gender, though certain lifestyle factors can increase the risk. Symptoms often include difficulty swallowing, weight loss, and chest pain, among others. But the real danger of esophageal cancer lies in its ability to progress without noticeable symptoms until it reaches an advanced stage, making early detection and treatment crucial. Now, why is the history of esophageal cancer treatment important, you might ask? Well, understanding where we've been can help us appreciate how far we've come, and perhaps more importantly, where we're headed. Medical advancements don't occur in a vacuum. They are built on the knowledge and experiences of those who came before us. The progress we've made in treating esophageal cancer is a testament to human resilience and ingenuity, and studying this evolution can provide valuable insights for future medical breakthroughs. So, in today's discussion, we're going to delve into the fascinating journey of how esophageal cancer treatments have transformed over the centuries. From the rudimentary methods of the ancient era to the cutting-edge treatments of the 21st century, we'll explore how our understanding and management of this complex disease have evolved. Fasten your seatbelts as we journey through time, exploring the evolution of esophageal cancer treatments. It's a tale of human innovation and perseverance, a testament to our never-ending quest for a healthier world. So, stay tuned as we embark on this exciting journey of discovery. We start our journey in the ancient era, where the understanding of diseases and their treatments was still in its infancy. The ancient era, a period of time where medical science was more of an art than a science, and where the mysteries of the human body were just beginning to be unraveled. Esophageal cancer, like many other diseases, was not understood in the way we know it today. The concept of cancer itself was foreign, and the symptoms of esophageal cancer were often mistaken for other ailments or simply ignored until they became too severe. In those times, the understanding of disease was largely influenced by the humoral theory, which proposed that the body was composed of 4 humors: blood, black bile, yellow bile, and phlegm. Illness was believed to result from an imbalance of these humors. As such, treatments for ailments often involved methods to restore this balance. For esophageal cancer, and indeed for many other diseases, this usually meant bloodletting or the administration of herbal concoctions. Bloodletting, the practice of draining excess blood from the body, was a common treatment for all sorts of ailments. This practice, while now known to be ineffective and often harmful, was a mainstay of ancient medical treatment. Herbal medicines were another common approach. The ancients had a broad knowledge of plants and their potential healing properties. They would prescribe various herbal remedies in an attempt to soothe the symptoms of esophageal cancer. Some of these herbs were indeed beneficial, providing some relief from pain and discomfort, but they were far from a cure. In the absence of a clear understanding of the disease and without the tools and knowledge to effectively treat it, esophageal cancer was often a death sentence in the ancient era. The treatments were rudimentary at best, offering little more than temporary relief from the symptoms. As we can see, the understanding of esophageal cancer was limited, and the treatments were far from effective. Moving forward to the Renaissance period, a time of significant discoveries and advancements in medicine. This era, spanning from the 14th to the 17th century, was a golden age for the exploration of human anatomy and the human body's inner workings. Our understanding of diseases, including esophageal cancer, took a quantum leap forward. Physicians during the Renaissance began to challenge the ancient medical doctrines that had been accepted for centuries. The belief that disease was caused by an imbalance of humors started to fade, making way for a more scientific approach. The concept of cancer as a localized disease that could spread to other parts of the body began to take shape. This shift in thinking was crucial in the fight against esophageal cancer. The Renaissance period also marked the advent of surgery. Although rudimentary by today's standards, these early surgical interventions were groundbreaking. Surgeons began to understand that removing a tumor could potentially save a life, and thus the idea of surgical intervention for esophageal cancer was born. However, these were perilous times for patients. Without the benefit of modern anesthesia or sterile surgical environments, surgeries were extremely risky and often fatal. Nonetheless, the brave pioneers of this era laid the groundwork for the surgical techniques we use today. The Renaissance period also saw the development of medical instruments. Tools designed for probing, cutting, and suturing became more refined, allowing surgeons to operate with greater precision. These advancements, combined with an evolving understanding of human anatomy, led to more successful surgical outcomes. Throughout this period, the understanding of esophageal cancer continued to evolve. Physicians began to recognize its symptoms and differentiate it from other diseases. They understood that difficulty swallowing, weight loss, and persistent cough could be signs of this deadly disease. This newfound knowledge paved the way for early detection and improved patient outcomes. The Renaissance period saw the dawn of surgical interventions, a significant leap in esophageal cancer treatment. This era's discoveries and advancements laid the foundation for the medical breakthroughs that were yet to come, bringing hope to those afflicted with this challenging disease. Now we venture into the 20th century, a time of rapid advancements in medical science. As the calendar pages flipped over into this new century, the medical world was on the cusp of breakthroughs that would redefine our approach to many diseases, esophageal cancer included. One such breakthrough was the advent of radiation therapy, a treatment that uses high-energy particles or waves to destroy or damage cancer cells. Imagine, if you will, a world where we could target the rogue cells causing havoc in the body, while leaving the healthy ones largely unscathed. That's exactly what radiation therapy promised, and it delivered. It became a cornerstone in the fight against esophageal cancer, often used in conjunction with surgery to enhance the chances of a successful outcome. Yet, the 20th century had more up its sleeve. Chemotherapy, another revolutionary treatment, was also introduced. This approach uses powerful drugs to kill cancer cells throughout the body, not just in the esophagus. It was a game changer, offering hope to patients with advanced or metastatic disease, for whom surgery was not an option. Chemotherapy and radiation therapy, often used together, brought a new level of sophistication to the treatment of esophageal cancer. These therapies could be customized to the individual, considering factors such as the type and stage of cancer, as well as the patient's overall health. But it wasn't just about killing cancer cells. The 20th century also saw an increased focus on improving the quality of life for patients. Palliative care became an integral part of the treatment plan, addressing symptoms and side effects to improve comfort and well-being. The story of esophageal cancer treatment in the 20th century is one of progress and hope. It's a testament to the power of medical science and to the tenacity of the human spirit in the face of adversity. The 20th century brought about a paradigm shift in the treatment of esophageal cancer with the advent of radiation and chemotherapy. And with this shift, the future looked a little brighter for those grappling with this formidable disease. We now arrive in the 21st century, a time of extraordinary medical advancements. In this era, the fight against esophageal cancer has been revolutionized with state-of-the-art treatments. Let's delve into these groundbreaking therapies that have been transforming lives. Firstly, let's talk about targeted therapy. These are drugs or other substances that can identify and attack specific types of cancer cells, causing less harm to normal cells. For esophageal cancer, targeted therapies like trastuzumab and ramucirumab have shown significant promise. They work by blocking the growth of cancer cells and preventing them from spreading, significantly improving patients' quality of life. Next, we have immunotherapy. This is a type of biological therapy that boosts the body's natural defenses to fight cancer. It uses substances made by the body or in a laboratory to improve how your immune system works to find and destroy cancer cells. For esophageal cancer, drugs like pembrolizumab and nivolumab are used as part of immunotherapy, offering a beacon of hope for those with advanced stages of the disease. But it's not just about drugs. The 21st century has also seen the rise of minimally invasive surgeries for esophageal cancer. These procedures, such as endoscopic mucosal resection and endoscopic submucosal dissection, allow doctors to remove cancerous cells without the need for major surgery. The result? Faster recovery times, less discomfort, and fewer complications. And the journey doesn't stop here. Researchers are tirelessly working on developing better treatments. Clinical trials are underway for new drugs, and scientists are studying the genetic makeup of esophageal cancer cells to understand them better. The goal? To design treatments that are more effective and less toxic. The 21st century is indeed a time of hope for those battling esophageal cancer. With continuous advancements in medicine and technology, we are inching closer to turning the tide against this formidable disease. With the dawn of personalized medicine, the 21st century has brought hope to many suffering from esophageal cancer. We've journeyed from the ancient era to the present, witnessing the remarkable evolution of esophageal cancer treatments. Our journey began in the ancient era where the understanding of esophageal cancer was limited, and treatments were rudimentary. Herbal remedies and basic surgical interventions were the mainstay, but with limited success. As we moved into the Renaissance period, the medical world experienced a significant shift. The invention of the microscope opened up a new world, allowing for a better understanding of the disease. Despite this, treatment options were still limited to surgery and rudimentary forms of radiation. The dawn of the 20th century brought about an era of medical advancements. The discovery of X-rays and development of new surgical techniques provided new hope. This period saw the introduction of endoscopy and esophagectomy, offering a more targeted approach to treatment. Yet, mortality rates remained high due to the aggressive nature of the disease and lack of early detection methods. In the 21st century, we've seen a quantum leap in the field of esophageal cancer treatment. The advent of targeted therapies, immunotherapies, and advanced surgical techniques has significantly improved patient outcomes. Early detection methods have also advanced, with the development of high-resolution imaging and genomic testing. These are crucial in diagnosing the disease at an early stage where treatment is most effective. Yet, despite these advancements, esophageal cancer remains a formidable opponent, largely due to its often late-stage diagnosis and aggressive nature. The focus has therefore shifted towards prevention and early detection, with lifestyle changes and regular screenings being emphasized. As we look towards the future, we hope for even more effective treatments. The promise of personalized medicine, where treatment is tailored to the individual's genetic makeup, holds great potential. Research is also underway to develop more effective screening methods and better understand the disease's genetic basis. We're in an exciting era of medical advancements, striving for a world ultimately free from the pain of esophageal cancer.